When most of us think of arthritis, we think about the painful symptoms such as achy, stiff joints, but you might not know that there's actually two different types of arthritis caused by very different things, and each require different treatment plans. Dr. Basra with Lake Charles Memorial Hospital is here to walk us through all the information we need to know specifically about rheumatoid arthritis, because it is vastly different from osteoarthritis.
Absolutely.
All right. What are those two main differences in a nutshell?
So rheumatoid arthritis is an autoimmune disease. That means your immune system is actually fighting against your own joint. However, osteoarthritis is age-related, wear and tear kind of arthritis. Rheumatoid arthritis, typically swelling is a hallmark of the disease. You know, you will have a lot of swelling in your joints. Typically hands and feet are involved. In osteoarthritis, the pattern of joint involvement is a little different than rheumatoid arthritis. It typically affects weight-bearing joints like knees, hips. Hands can also get involved, but the pattern is a little different. You know, these particular joints right in here are less commonly involved as compared to...
So right along your knuckles.
Right around your knuckles and wrists are less commonly involved as compared to rheumatoid. And the swelling is also less prominent as compared to rheumatoid.
So if someone's waking up in the morning, they've got some swelling in their knuckles, on their hands, on their feet, and it lasts a little bit longer, that could be one of the major symptoms of rheumatoid arthritis.
Yes, stiffness is another symptom that you can differentiate. You know, stiffness in rheumatoid arthritis typically lasts for more than 30 minutes, more than an hour actually, and stiffness in osteoarthritis lasts for about 15 minutes to 30 minutes every day. So that's how you can also differentiate rheumatoid and osteoarthritis.
Now something else that's interesting, because rheumatoid arthritis is an autoimmune disease, it can affect a lot of other areas of your body as well.
Absolutely. So there are extra-articular manifestations. So it's not just restricted to your joint. About 10% of the rheumatoid patients can have skin nodules, you know, which can also be seen in other diseases, but it's common in rheumatoid.
What exactly is a skin nodule?
It's actually inflammation within the skin or underneath the skin, and you can find it around your elbows, around the extensor surface of your hands. Okay. And but it's not very common. It's only seen in 20% of the patients. About 20% of the patients can also have lung inflammation, that is having chronic immune system problem. Their lungs can get inflamed. Dry eyes and dry mouth is very common. Rheumatoid arthritis, inflammation within the eye can happen, and these patients, because of continuous inflammation in their body, have increased risk of developing coronary artery disease as well.
So it's imperative to not only get diagnosed, go and see a doctor, go and see you guys at Lake Charles Memorial Hospital, but to do that early. It's sort of a preventative measure from having things get a whole lot worse.
Absolutely. Earlier you diagnose rheumatoid arthritis and you start the treatment, you can actually halt the progression of the disease or even stop the progression of the disease, and the patient can live a normal life. And a lot of this extra-articular manifestation, you know, we can keep it under control if you already have one, or we can prevent that to happen as well.
What are some of the treatment options that you offer at Lake Charles Memorial Hospital?
Well, it's different for different kind of arthritis. For rheumatoid arthritis, typically disease-modifying agents. These are immunosuppressive drugs that will work with your immune system and try to prevent the inflammation within the joint, and they can stop the progression of the disease if you can get them started on time. However, in osteoarthritis, there's no role of disease-modifying agents. And you know, typically it's injections, you know, exercise, and you know, lose weight, all those typical things that you need to follow.
Healthy things that you need to do.
But there is no drug. You know, you can take pain medications like over-the-counter Aleve, ibuprofen for osteoarthritis, but there is nothing that can change the underlying process. However, rheumatoid is a treatable disease. It's not curable, but there are a lot of drugs nowadays. There are biologics that you can use and live a normal life.
Well, if you are interested in getting more information about rheumatoid arthritis, we've got the number there for Dr. Basra on the screen. And we thank you so much for coming by to talk to us about it today. It's really interesting information.
Thank you.
All right. Up next, we're getting the details on Saturday's Tour Lafitte. Stay with us.